Discover the emotion of victory in motion. Home of knee repair, not knee replacement.
Collagen is a protein, and there's different types of it, but it's the main kind of soft tissue building blocks of our body. Type 2 collagen is the type that cartilage is made out of. And cartilage lines the end of our bones, like the tread on a tire, which we've been talking about. And the meniscus also is a shock absorber cartilage in between the bones, which is a different type of cartilage. And that has some type 1 collagen in it. And so does our tendons, our muscles. Type 1 collagen is probably, I think, the most common collagen we have. But type 2 collagen is the collagen that's in cartilage. By eating type 2 collagen, especially hydrolyzed type 2 collagen, some of it may get into the joints and help with the building blocks. I mean, our cartilage does slowly turn over. We have chondrocytes, which are cartilage cells, and they produce a matrix. And the matrix is the white stuff that you see, that's what the cartilage is. So there's not a lot of cells. It's kind of like, if you looked at it under a microscope, it looks kind of like a honeycomb. And there's all these little small cells, and there's a whole bunch of matrix. And the matrix is made out of collagen and glucosamine and chondroitin sulfate, which I'm sure there's another question on glucosamine and chondroitin sulfate, so I might as well tackle that right now. Glucosamine and chondroitin sulfate are part of the building blocks of our cartilage. And so by eating the collagen, like Knox Nutrijoint, that was always a big one, like gelatin or jello is made out of collagen. But there's now these hydrolyzed collagen, which you are able to digest easier and better, maybe get into your system at a higher level. And so, yeah, you need building blocks for your cartilage. Now, having said that, you can take a hydrolyzed collagen supplement. You can take glucosamine chondroitin sulfate. No one's ever shown that either one of those grow back new cartilage. There is a little evidence that it may protect the cartilage you have left. And there is some evidence that it helps with some of the pain that people have from arthritis. If we know what your exact genetic makeup is, and we know what the best diet is for your genetics, which is what we do, we don't just say, oh, you should be on a high protein diet, or you should be on a low carb diet, or you should be on a carnivore, or you should be on a vegan diet, because we don't know what your genetics are until we know. So what we do is we do test you. And then, yeah, you might be, Luchi, you might be a carnivore. I might be a vegan. Someone else might be Mediterranean. Whatever your genetics are, whatever diet's best for that, to decrease inflammation in your body and give you the right nutrients, that's probably going to have more effect on your joints than taking supplements. Having said that, if you don't eat a well-balanced diet and you did want to spend the money, because all these things cost money, and they're all supplements, so you never 100% know what you're getting. They're not regulated by the FDA. So always ask your pharmacist, ask your doctor, always ask your doctor, what do you think about this? Is it best for me? And if you do use those things, it might help a little bit, but it's not going to make an 81-year-old knee feel or look like an 18-year-old knee.